If your Botox is not lasting, tell me right now how much Botox you're getting. I need to know your numbers. I want to know your dose because that is going to determine why it's not lasting. So, when we do Botox, how much you do determines how much that's going to weaken the muscle and then how long it's going to last. The stronger the dose or the more that you do, the longer it lasts, the more restricted the muscle is. Everybody gets a different dose. The dose depends on how strong your muscles are, how big the area is, what you want the outcome to be. And so that determines how much you get. So if you're like, I want to go light, I want a baby dose, I expect it to wear off in a baby amount of time. It's going to last just couple months maybe. So that is something you really need to ask yourself. If you're telling your provider, I want to go natural, I want to be light, I want baby dose, that's why your numbers, that's why your Botox is wearing off quick. Since 2013, I went to Stanford, I went to Duke. I have 3 medical spas, Jossie Skin and Wellness. You can find us in Los Angeles and Las Vegas. I am here to help you out. Drop any questions you have in the chat. We will go through them. And if not, I will talk through all the most frequently asked questions that I hear on a daily basis as a cosmetic nurse practitioner. So in our office, we focus on natural looking aesthetic results, safe for all skin types, all skin tones. We treat all ages, all backgrounds, women, men, everybody in between. And we really focus on skin health, hair health, and then natural looking aesthetics. So your natural injectables, we have PRF EZ Gel. This is made entirely from your body's own growth factors and stem cells. Your body will make new collagen wherever we place this in your face over time. We also have your regular Botox, your regular filler. So anything you have, any questions you have on any of these things, let me know. In general, we can talk through how much Botox you're going to get. We can talk through what age to start getting Botox. This is what a lot of people will ask me. So when it comes to doing Botox, I say start when you feel ready. Don't start because somebody else is telling you to do it. In general, a lot of people start noticing lines starting to get a little bit etched in on the skin when they aren't making animation. So when they aren't frowning, aren't raising their brows, aren't squinting, but they start to see them starting to get etched in, usually like into their late 20s, early 30s. When they're getting those like light little faint lines, you probably want to come in and do it before those lines get deeply etched in on the skin. When the lines are deeply etched, it gets hard to try to take them away. So the best thing you can do is try to prevent them. Easy thing you can do is try not to make such hard facial expressions. But if you do make a lot of animations, Botox can help weaken those muscles so that those lines don't get etched on the skin. I started getting Botox when I was 28 years old. Actually, that photo of me is before I had done any treatments there. And I don't know if one of our team members is on. If they're on, I'll invite them in. But I started getting Botox at 28. I am now 38. I haven't had Botox in a few years because I'm still breastfeeding this baby. But I love Botox. And when I do Botox, I like to be a little bit more restricted. How much Botox you do, remember, it's going to depend on your face, your goals. And so this is why in our office, we ask a lot of questions about what you're trying to achieve before we just start poking your face. If you have come to our office, you know we ask a lot of questions. We're very thorough. We want to make sure you understand everything we're doing, why we're doing it specific to you. We want to make sure you're able to make informed decisions, not rush decisions. So we're really there to help answer your questions. We build out treatment plans with you. Typically, before you even come into the office, we're meeting with you virtually to go through your questions, your goals, tips on what to expect, how to prep for treatments. And so then you're able to be best prepared before you even come in for your appointment. So our patients really like that. We don't want you feeling like pressured. We're not that type of clinic. We don't want you feeling pressured or feeling you have to make quick decisions. Should I do this now? Should I do this now? I'm like, if you're thinking about that, I'm like, nope, go home, think about it. There's no reason to like do this today. We can always do this stuff. Botox, filler, all of our skin treatments will be around at any point, but we want you to be able to feel comfortable and have an active voice in the treatment plan. So this is why we ask so much about you and your background. If you're getting ready for events, if you've got flights, or you're trying to change weight, so many things. All these things play. What is your job? What do you do for work? All those things play a role in developing that treatment plan. Okay. Let's see. Miss B said she got lip filler for the first time today. I'm super excited for you, Miss B. When we do lip filler in our office, we do it slowly. We do some. We want you to see a result, but we do some, let it settle. We let them know we can always do more. We can always add. Biggest things when we're doing lip filler is we don't want to overdo in anywhere in the face. We don't want to have too much. We want to make sure your shape is nice. We don't want the lips protruding past the chin. We're thinking about the entire face. We're not treating in isolation. So whenever we do something, we're like, how can this impact another area of the face? So when we're doing lips, we might do some into the corners of the mouth. We might do some into the chin. It really just depends on making sure those lips are appropriately framed with the rest of the face. Things to think about after you've done filler. Usually the next day is the worst of your swelling. Some people really like swelling. Other people are like, what the heck? This looks too much. Just know it swells and then it starts to come down. By week 2 to 3, you have a pretty good idea of what your result will be, but it does take 6 to 8 weeks for that product to completely integrate, to like mesh in with the skin. So you might feel little bumps. We tell our patients, hands off, don't touch them. You don't need to massage them. They will settle on their own. But yeah, if you want to add more, we wait at least 6 to 8 weeks before we add more. That way we can keep your shape. It's not puffy above the border. We're not doing too much. I know you guys have all seen really bad lip filler walking around in the streets. Like we don't want that at all. So that is how we approach lips and everything we do. Okay, let's see. And then I'm 19 years old. I have a little bit of smile lines. What should I do? You're so young and probably just so beautiful. At 19, your face is changing a lot. I say, I don't get hung up over the smile lines. I tell people, I'm like, you're going to have some lines. If you want to soften lines, I think 19 is a little bit young, but I'm not here to tell you what to do with your face. Your face is going to change a lot though. If you want to soften smile lines, soften them. I don't say try to get the smile lines all the way gone. You know, these lines are there because we're smiling, we're talking, we're making expressions on the face. If you try to chase them to be gone, it can look puffy on their face, blown out. You don't want that. So we can put support under them so they're not so deep, but our goal is not to take them all the way away. You can do natural filler, PRF EZ Gel. So that is where we create a filler alternative entirely from your body's own growth factors and stem cells. So we do a simple blood draw from your arm in the office. We spin your blood in the centrifuge. It separates out your growth factors, your stem cells. We take that part, we heat it and cool it. Nothing is mixed inside of it. And then we make a gel out of your growth factors and stem cells, and we can inject that into the smile lines, the under eyes, the mid face, anywhere in your face. Your body's going to make new collagen over time. I really like the natural filler. If you're not trying to get an instant effect, that is something you have to keep in mind. This is one that progressively improves as your body makes new collagen. It can take up to 6 months for the body to make new collagen, so that's something you got to keep in mind. But I like that. I've been doing the natural filler in my own face for the past couple of years. I told you guys I'm still breastfeeding, and I feel like it just looks nice. It looks natural. It doesn't look done. It doesn't look puffy. It doesn't have like super hard structure. So if you're really like, I want super chiseled cheeks or chiseled jawline or like a really strong defined nose bridge, it's not for a lot of structure, but for like volume loss, for sunkenness, hollowness under the eyes, subtle, I think it is really great. Okay, somebody said, I saw one about thoughts on nose filler. I know people have mixed feelings. I do nose filler in our office all the time. I love nose filler, making sure patients understand limitations of this treatment and like what they can expect with it. So with nose filler, we can camouflage a bump on the nose. We can lift the tip of the nose. We can create like a bridge and make the highlight look straighter on the nose. We can minimize asymmetries. We can help with the nostrils. Some people will have like one is more round or one is more triangle, so they want to try to make the shape look a little bit, similar. So we can do all this without surgery, without downtime. You're able to see the result right then and there, which patients like. And again, as I mentioned to you guys earlier, anything we do in our office, we do it. You're going to be able to see a change, but we don't want to rush it. So we do some, let it settle, reassess. We can always do more later. So we come back. Usually we see about 6 to 8 weeks later to like further fine tune if we need. If you come back and you're like, oh my gosh, my nose looks absolutely perfect, we don't want to just be putting filler in there unnecessarily, but we have that extra appointment in case we want to, it swells up and it comes down a little bit. We can always do a little bit more at that second appointment. And then your nose filler is going to last. I tell patients 1.5 to 2 years. Most patients get longer out of it, and they really like it. So what it won't do, if you have like a really full nose and you want it really pulled in tight, I'm like, that's going to be a surgical thing. So if your nose is wide, just know that's going to be a limitation there. But I've worked on patients that have had multiple nose jobs and they're still coming to get some refinements with filler. So safety with filler in the nose and anywhere in the face, what we want to be mindful of is that we don't block blood flow off. So we got blood vessels, our whole face, our whole body. We don't want to put too much filler in any spot where blood can't move like normal. So when we're injecting, we're looking for your skin color to be normal. You shouldn't have any extreme pain. You shouldn't have any vision issues. If you had any of those signs, it could mean somehow we're blocking blood flow off, and then we would need to dissolve the filler. I have been a cosmetic nurse practitioner since 2013, so for 13 years, I've never had to dissolve anybody for any emergent reason, any filler, any part of their face. So really, really rare, but we want to be mindful of these rare risks, be equipped to intervene if we need to take care of the situation and know what to look for. And this is what we also teach our patients. So that is how we're approaching it. I want you guys to know when it comes to aesthetics, this isn't just like poke, see ya. There's a lot of thought that goes into it before we can decide what to do, when to do, what product to use, how much to do, how we're going to timeline it out. So that is why we ask so many questions. That's why you guys are probably like, this girl's talking so much, but it's really, we want you to understand what's going on. This is not random what we're doing. And this is not just willy-nilly, we're just throwing something in there. No, there's a lot that goes with it, a lot that we're considering as injectors. So I have a team of providers at Jawline Skin and Wellness with me. We're thinking about anatomy. We're thinking about what's going on underneath the skin, not just how can I get a pretty result. First and foremost is safety, and then understanding, is this going to look nice on the patient? If not, we don't want to do these random things and make you look weird. So that is a lot that comes into with it. Okay. Dana said, is this picture before and after Botox? So this is me when I was 28 years old. I'm 38 years old now. I'm feeling a little tired. I'm weaning my 2.5-year-old baby. So my husband has him right now. It's been a little bit of a trial with this baby. This is my third baby. So after my first one, I had lost a lot of weight. I breastfeed for 2 to 2.5 years, and I have 3 of them. After my first one, I lost a lot of weight, a lot of fat. He was sucking all the fat out of my face. So I noticed a lot of volume loss underneath my eyes, my temples, my smile lines, my cheeks, everywhere. I have done filler in the past. I just haven't had filler in over 3 years. I was pregnant. I've been breastfeeding. And so this is when I had done some filler a few years ago. I've been maintaining my filler results these last few years with the natural filler. So that's when we talked about earlier, the one where it's made from my own growth factors and stem cells. So I've done that underneath my eyes, my smile lines, my cheeks, my chin, my corners of my mouth. I would probably do another session. It's been some time. I'm I feel like I need to do that, and probably a chemical peel maybe this week if I can get one of my team members to do it. We have just been rolling in clinic. It has been so busy. Everybody's just getting ready for the 2026 year, looking fresh. So I haven't even had time to do my thing. But if I do it, I will. I'll join you guys in live so you can see. Okay, let me see. I want to get some fillers, but I don't know what looks good on me. So if you want to do treatment and you don't know where to start, this is why we'll do consultations. So I love to do virtual consults with my patients before I see them. If not virtual, we'll see you in person and go through these things. But the virtuals really allow us some time to go through your questions, your goals, tips on what to expect, how to prep for treatments. I've been doing these virtual consults since 2020. I'm very well versed on them. I know I can look at the face pretty quick and have an idea of what we're going to be discussing. And after I hear you out, I can give you great recommendations to have you prepped for your appointment, and we build out that treatment plan. So patients like this, the patients that do virtual consults, they are well prepared for their appointment. They're able to do their pre-care. So they start using the right things beforehand. They stop using certain things. We plan out the appointment time, so we make sure it's good timing for you. You don't have any major events going on. Like we know the timeline. So we talk through everything before you even come in. After we finish talking, I write up detailed notes about what we discussed. I have my team send information about what we discussed to you. We send videos, we send written information so you can further review it. We send you pricing, we send you financing. So that gives you time to like review all of this info, make sure, again, the timing is right for you. If you have more questions, I'm like, call us, text us, we can go through this, anything you need. I don't want anybody feeling like, oh my gosh, I'm in the chair, I have to do this now. We're not that type of place. Like, this is not what we're trying to do. We want you to, again, make informed decisions, not rush decisions. This is also why I'll get on here. This is why I try to do so much education. I like to answer questions. I like you to know what's going on. And you guys know I talk so much, but I have a lot to say about each question because it's important. Like, you know, all the things going on in my mind. It's nothing is random. And you can bring in your twin sister and I can have entirely different treatment plans. So much goes into what we're doing, but it's after we have that conversation, then we can develop that. And you can book those virtual consults through the number at the top of my page or through the link through there as well. Okay, let me see. Sorry, it says 50 questions. I'm gonna get, I think it just went all the way down. So I'm gonna read these and I'll scroll back up. Okay, I lost 20 pounds over the course of a year and a half. How do I tell if it made my face hollow? So things that you can do, if you don't know, if you're like, sometimes people are like, I don't know. They're like, my face just, I don't know what's going on. My face looks different. I can't tell exactly what it is. I just don't feel like I look my freshest self. I can talk to you. I can tell you what I see, understanding like this is what I do and I have studied for years and I understand like facial aging and what's going on beneath the skin, where fat pads are separating, where they're sinking. I know that just because this is what I study and this is what I do. So I can look at your face and kind of say, hey, I can see where light and shadow hits off your face, or here's how we can make things look a little bit brighter or more lifted. That is one thing. But other times I'm like, hey, a lot of times I'm like, hey, show me a picture of you whenever you felt the most beautiful, the most fresh. And I don't care if that is when you were prior to weight change. I don't care if that was 5 years ago. I don't care if that is a filtered photo. I can look at those photos and look at your face and pretty quickly assess the differences. Like I can look at, again, where light is hitting off the face, where shadows are. And I can be like, oh, okay, when I see this, I know exactly. If you're telling me you love this, I might ask you like, what do you like about it? If you're just like, I don't know, I just feel the most beautiful. If you show me a few, I start looking at like, if every angle is like this or like this, like I can start being like, oh, okay, they like when light hits off their face up there. She's trying to make it look up here. Oh, she's coming from down here. She likes when her lips look fuller when she's below. So this is just what I do and what I know. And so I'm able to decipher this pretty quick. This is just God's gift to me. And able to like pull off, get the result. So if you look at the reviews, if you look at our patient before and after photos, if you look at our patients, they look fresh, they are happy. Like read the reviews on our page. You can look under my name. My name is Ginille. Our clinic name was Ginille Beauty Aesthetics, but then I have all these team members. I was like, this is not the Ginille Beauty Aesthetics show. It's Jawsy Skin and Wellness, JASI. So we changed that out at the end of last year. But like read the reviews. So many patients make their own videos about their experience. You can see their before and after photos. And I always say thank you to our patients. So many of them have consented their photos to share. I love using these so you can see what natural results look like. Everybody thinks that, oh my gosh, I can tell when somebody's had Botox and filler and it always looks overdone. And I'm like, it doesn't though. Like you can tell the ones that look bad. So that's the whole point. Like these people look natural. If you just saw their afters, or if you just saw these people walking on the streets, you wouldn't know they'd done anything. You just think they look fresh or they're aging gracefully. And I'm like, no. We've been doing skin treatments and natural filler and Botox and all the things. So Again, shout out to my patients. Thank you for sharing. Sometimes they come on here and there's probably people in the comments, so I will read through these. And then if you have questions, let me know. I'm going to scroll back through them. Hi, Michaela. Thank you so much. Yes, I'm in Torrance. So we have 3 offices. You can find us in Los Angeles, Mar Vista, so like outside of Culver City, and then Torrance in the South Bay side, and then Las Vegas on the Summerlin side. I see patients out of all the offices. I'm based in LA, so I'm in those offices mostly, but I'm in Vegas like 2 to 4 times a month. So I was in Vegas Friday. Was that yesterday? Yeah, I was in Vegas yesterday we had a full day of patients. And then I'm in Vegas again next week, full day of patients. But I also have providers that are seeing patients when I'm not there. So you can see our providers. These are girls that I have worked alongside and trained, and they are so well versed. And you can read their reviews and you can see their patient before and afters. Thank you so much for your loves. And they are excellent. And like, I'm sorry, I just straight up stand for excellence 100% every single time. And that's how the girls are. So they're very, very great. Kip said, sounds awesome, but super expensive. I mean, I don't know. I don't know what is expensive to you. These things, I'm like, you can find stuff that's going to work within your budget. Because I'm like, okay, if you want to tell me stuff, if I can tell you stuff that like doesn't cost anything, we can just talk about that. It's going to be like, do the basics, which is like, sleep on your back. So you're not laying on your face. Laying on your face is going to cause creases. Wear sunscreen. If you can't afford sunscreen, stay out of the sun. Cover your windows. Those are things that cause visible signs of aging that people don't always think about. Drink water, strength train. Like those are basic things that you can do at home. Wearing sunscreen, using a retinoid at night is going to help you age better. And I'm like, let's protect against skin cancer. So sunscreen is a big one. That doesn't cost much of anything. When it comes to Botox and filler, people have different budgets, and a lot of people really prioritize these things because how it makes them feel, how they're able to show up and look and feel their best self and be confident. And I have seen how this has transformed people's lives. It is so much bigger than a shot of Botox or a shot of lip filler. I think a lot of people think, oh my gosh, this is just some superficial thing and she's just trying to get her lips plump. It's not like that. Like, it impacts people in such big ways. I hear stories from my patients all the time, and I see them glowing. I see them from their first appointment to their next. You can even see it in their before pictures to the after photos. I'm like, stop smiling in the afters, but they're just so happy. I've seen people, oh my gosh, they cry all the time. They're just like so excited they're like, whatever this little thing was for them that made a big difference, whatever they felt insecure about or not their freshest self about, to see it have that change, it is very impactful, very powerful. And I hear these stories every single day, and that is like what drives me. I love it. I absolutely love connecting with their patients. I love hearing their stories. I learned so much from my patients, and I see patients from all over the world every single day. Somebody has flown in Vegas yesterday. One of my girls flew from New York. They come from everywhere outside of the US all the time. The other girl came from Seattle. Like, these are the things, and I'm so grateful for the patients that are traveling and for the ones that are here. But I'm also like, hats off to you for like doing the research and taking the time. Like, they're making very, again, well-informed, thought out decisions. They're not here just making a rush decision. I don't want to say this like annoyingly, but like, I feel like I have a lot of stops to make an appointment to get in with our team. It's like, I want to make sure you understand all of this. I'm doing this one out of like protection to the people. I'm not here. We are not a Groupon clinic. We are not a get in, get fast. No, we're not about fast results. We're about safe results that are going to be beautiful, long lasting. You are going to look fresh. Some of these people I have seen my entire career, 13 years, and they look so fresh. They look like you would never know they've done anything. They look 10, 15 years younger than their age. People don't know that they've ever done anything. They can't clock it. They don't know that they're their age. That's the whole point. That's the whole point. So anyway, I need to be answering these questions. Also, we have financing. When someone is talking about expenses, we have financing. So, people will break up their beauty treatments into payment plans. So a lot of people like doing that. Okay. Okay. Ashley's amazing as well. Yes, Midnight. Thank you. She said, I'll come to see you. Dana, I would love to see you too. Okay. Let me see. I'm trying to scroll and make sure I got these questions. Does each section have different duration for upkeep? Asking for a financial reason. Does each section, do you mean about, okay, I'm not, Stephanie, tell me your question. I'm going to try to answer it in the way I think you're asking me, but clarify if I'm not answering this right. So does each section have different duration for upkeep? So maybe you're thinking about if we do like your Botox for your forehead lines, your frown lines around your eyes. In general, your Botox is typically going to last. It depends on the dose. Remember, I can make your Botox last for a year if we do a really strong dose. But most people, the way they dose it, are going to do it like 3 to 4 times a year for their Botox. So remember, Botox for stopping the frown lines from getting etched in, the forehead lines around the eyes. Those are common areas. We do it also for TMJ symptoms, headaches. We can do it for like a little lip flip, the bunny lines. Remember, I have no Botox, so ignore my face because I'm breastfeeding this baby. So Botox, think a few times a year. Your filler, if you're looking at like trying to soften lines, create a lift, volumize, hydrate, plump an area. Your filler, you're going to do a couple sessions. Like I said, do one, let it settle, reassess your face about 6 to 8 weeks later. And then if you need to add or want to add at that point, you can. After you're at your goal with your filler, your maintenance between 1 to 2 years. So at that point, we just kind of check in. If you're like, I'm fresh, like, don't come in. Like, I'm not saying don't come in. I would love to see you. But, like, you don't need to come in for filler. So when you're kind of noticing it fade, or if you go through changes, some people will be like, hey, I changed weight. You're doing stuff like that. That's when you can notice it might wear off a little faster or things look different. So 1 to 2 years for your filler. Your natural filler, you're probably going to be coming in on a annual basis to maintain. The natural one is made entirely from your body's own growth factors and stem cells. And we just want to help with that new collagen. And you're going to do a minimum of 2 sessions of those, spread those out 1 month apart, and then maintain about a year later. Okay, skin treatments. Your skincare, you're going to be doing routinely at home. We'll help you with the right skin products. I forgot to link them. Maybe I should do that. But we have Jossie Skin and Wellness in our office. This is a product line that I made. Can I link these? I'm going to try to see if I can link them really quick. Sorry. Hopefully you guys can still hear me. But these are products that I have created, and I only got 4 on here. I don't know. I put them on TikTok Shop, but I don't even know if they're up here. Hopefully you guys see them. Okay. These perform as treatment for you at home, and then they help extend the life of treatments that you're getting in the office. Safe for all skin types, all skin tones. They perform so well. So these are products that I use, our patients use. We absolutely love. These are just, I only linked 4 of them because I don't really know how to play around with this too much, but you can always call or text the team and they can help you with that as well. So we get you with the right skincare. Skincare is going to be your part that you're going to be doing at home. That is going, like I tell people, if they're trying to, especially when you're starting to do skin treatments, I'm like, we are not going to take your money and start this if you're not going to do like wear sunscreen or, try to minimize whatever triggers there are. So when I say triggers, let's think about acne. Some people will tell me every time I eat candy or drink wine, I break out. So I'm like, okay, cool. I have this laser that is going to work very well at killing bacteria and reducing inflammation in the skin. It's going to help with your acne like a lot, and we can get this cleared. And it's safe for all skin types and all skin tones, and there's no downtime with it. However, if you're going to tell me that you're going to keep eating the wine every day and eating the dairy or the candy or whatever it is that's breaking you out, I'm like, this doesn't even make sense to do. So we want to think about this holistically. We want to think about all the factors. And this is why we talk so much to you, because we want to understand what's going on in the lifestyle, and we want to make sure that you understand, like, if you're going to invest in these things, let's do all the parts so that we can get the best outcomes. So that's why we want to get you on the right skincare. That's why we're going to talk through lifestyle. We talk through maintenance, all the things. So we don't want you using like nonsense products and getting skin treatments. And I'm like, well, your skin looks like trash. You are here for a reason. Like, those products are obviously not serving you. Let us get you on the right products, the right treatments. Let's talk through the changes that you can make, and you will see the change in your skin. In our office, I haven't even talked about skin stuff. It's my favorite thing. I told you guys I need to do my peel. I'm going to see if I can get one of the girls to do it for me this week. So in our office, we have a skin membership program. This is where you come in on a monthly basis and you have access to our skin treatments. We have Aerolase laser, bio repill chemical peel, skin pin microneedling, hydrofacial. So with these treatments, we can treat any of your skin concerns. So with acne, dark spots, fine lines, pores, hair removal, skin texture, acne scars. So we can treat all of that with these treatments. In the membership, you come in on a monthly basis. You do one of those treatments. It's $3.99 for the month, and you get to pick one of those. We can help guide you based off what's going on with your skin, and it may change from month to month what's going on with your skin. You might be like, oh my gosh, I've been super stressed, so I've been breaking out. And so we might be like, okay, the laser's going to serve you well, the pill's going to serve you well. Or you might be like, oh, I just came back and my skin is really dehydrated. I've been in the desert for the past 2 weeks. My skin is super dehydrated. We're like, okay, the hydrofacial is going to serve you well. So you get to pick and choose which one you want. You can also stack these treatments. So most of our patients are stacking them. They're doing 2 or 3 treatments on the same day. All of these pair very well together. You can do the laser, the pill, the microneedling all together on the same day. Or you can do the laser, the pill, hydrofacial all on the same day. You can also do your injectables. So people will come in and they'll do the natural filler on the same day and their Botox. You get a discounted rate for your natural filler. So patients really like that too. So that is the membership, and everything we do is safe for all skin types and all skin tones. I highlight that because I want you to know not everything in aesthetics is safe for Black and brown skin. And so it's really important to us that, I'm Filipino and Black, like whatever we do is going to be safe for the people we see. And we see everybody in our office. We see everybody. I will have a 97-year-old white woman, and then I will have a 25-year-old Black girl, and then I will have a 49-year-old Asian woman. Like, we see everybody all day. I will have a stripper, and then I will have a nun, and then I will have a flight attendant, and then I will have a boat rider. We see everybody, and I love hearing all the stories, and I love learning about the patients. And so anyway, the skin treatments, the skin membership, that's an absolute yes. Do that. Especially, I tell people, if you're investing in Botox or filler, if you're doing that and your skin doesn't look right, it doesn't even make sense. Don't even do it. Who cares if your lips are juicy and plump, but your skin is not looking right? Your skin is a foundation. It is the first thing that everybody sees. So we want to work on your skin health first. I promise you. Oh my gosh. When people's skin is just glowing and they're like, I've never gone a day without wearing makeup in my adult life. I never knew this, I could feel like this, and I feel so good and I feel confident. I just didn't know that was a thing. That is life-changing for them. They care about that more than they even care about, oh, I got rid of your frown lines with some Botox. So I say skin health is first and foremost. And that will, even if you never do injectables, the skin health will aid you the best. That is just kind of how you're going to look the freshest. If your skin is good, the lines don't even care as much of these smile lines. Nobody's even looking at that. So really, really focus in on your skin. We have a hair membership program as well. Anybody wanting to focus on scalp health, anybody with hair loss, hair thinning. So we have the scalp detox facial. You come in on a monthly basis. We do that. This is going to clean out the hair follicles. So we want to make sure nothing is blocking those follicles from growing. Sweat, buildup, product, we need to clean those out. We also do PRF injections. So we draw blood from your arm. We spin it in the centrifuge, separate your growth factors and stem cells. We inject that where you're noticing hair loss, hair thinning. That will help with new hair growth. We help you get started on the right supplements. We can do prescription medications as well. We have a Black dermatology nurse practitioner on our team. We see all hair textures. So everybody we will work with there, and they really like that. And they just feel like their scalp is healthier. Oh my gosh, I'm not having a dandruff. I'm not feeling so inflamed. I'm not so itchy. So that is an excellent program. So all these things we talk through, and I know it can be overwhelming because it can be a lot. It's oh shoot, what do I do? This is why we do a consult. And it's not just a one-time consult. It's every single time you come in, we're talking through what's going on. Give me feedback. How was that previous treatment? Was there anything you would want to have seen different? What else are you noticing? Because once you do one thing, people are oh my gosh, I did this, but now I'm what about this? This made me feel good, but what else can I do? So we talk through all of those things. And it's not just when you're in the chair. So if you have questions when you're at home, I'm like, call us, text us. Like, you have a team supporting you. It's not just when you're in the office. It's like, you keep communicating with us. Like, we are so hands-on. You will see in the office, everybody's always like, oh my gosh, like, you guys just, we just care, and we want you to feel safe, seen, heard, beautiful. Like, that is what I stand by. And that is the environment we have created. And yeah, so it's like you have a team, you have like a family behind you helping you. Okay, it says 62 messages. So I'm going to keep I'm trying to scroll back to the other ones. But you guys, I can't answer one question without going off for 20 minutes. Okay. Best treatment for under eyes. So if you have hollowness, sunkenness, volume loss underneath your eyes, that's when we can do filler or the natural filler to help restore that volume, help create a lifted look, and make things look brighter underneath the eyes. You're a filler candidate if you don't get puffy, you don't cry a lot, you don't have bad allergies. Anybody that retains a lot of water around their eyes, not good candidates for filler. If you put filler there, it's going to look bad. It's going to look puffy. It's going to swell up and down with you every time you get puffy. So we want to make sure you're a candidate before we do anything. Then the natural filler, everybody can do. Natural filler, again, made entirely from your body's own growth factors and stem cells. We do a blood draw in the office. Nothing else is mixed inside the tubes. We make a gel, a filler-like substance out of your growth factors and stem cells. Wherever we inject that, your body's going to make new collagen over time. So that is a gradual one. It gets better with time. Those are great for the under eyes. Other things you can do if you're like, I don't want to do injections, you can do your skincare. So using your retinoid, your moisturizer, your vitamin C, your sunscreen. Doesn't need to be a complicated thing. It's like 2 things in the morning, 2 things in the evening. It doesn't need to be several steps. We just want to use the right steps. So that's your part at home. You can do skin pin microneedling, and you can do your bio refill chemical peel for the eyes. Now, if it's a lot of volume loss, sunkenness, the skin treatments, the skincare is not going to restore volume the way your filler or the natural filler will. But those are great for like improving texture, subtle on the volume, but really not to like plump and hydrate the area. I have done all of those things that I've just mentioned. I did filler. This was, remember, I had lost a bunch of weight after feeding my first baby. When I did filler, I got the instant result. This last couple of years, I've been doing the natural filler, and I really like that because I feel like even though I'm 30, I'm 10 years older than this photo, or almost 11 years older than this photo. I don't feel like I've reverted back to that, even though I'm breastfeeding this big baby and I don't get good sleep because I've been doing the natural filler. So, okay. Monica said, getting Botox for the first time on Monday. Yay, excited for you. What's an average amount of units to start? So that really depends on how, like what areas you're treating and then what you want the outcome to be. So I posted a video maybe a couple days ago, and you can kind of see where I kind of say, hey, like in this area, I'm going to 20 units here, 20 units in forehead, 12 on each eye. I say those numbers, guys, so you can have like an idea of the numbers and that idea of how much we're doing. However, those numbers vary. Like, it depends. Like yesterday I saw one girl and she said, I'm a dancer. She's like, I don't want to frown at all. I just need to look cutesy all day. She's like, you freeze me up. She did way higher units. Then I had another lady she was her first time. She's a little bit older. She was like, I'm so afraid of this. I want to still like make frown motions, or I'm a therapist, I'm a teacher. Those patients will tell me they don't want to be frozen. They want to still frown. So I'm doing way less. I might be doing 12 units in the frown. Whereas if somebody else is like, freeze me up, I'm only coming here once or twice a year. I want it to last. I might be doing 50, 60 units in their frown. So the dose is going to depend on your face, how strong your muscles are, how big the area is, what you want the outcome to be. So it depends. Like if your first time, I usually tell patients your first time, don't go too crazy. Do like a medium dose where you can see the change, and then just know you can always make it stronger if you wanted to in 2 weeks. Or if you're like, hey, that was too strong, next time I can go less on your dose. So those are some things to keep in mind. I hope that helps you. Okay. Let me see. Midnight said, me and my puffy face. Excited for your results. I'm excited for you too. Okay. My filler has caused me a lot of water retention. So if your filler is causing you water retention, go get it dissolved. If you're somebody that's like puffing up and down, swelling a lot, I would go get it dissolved because it's going to hang on in there for a long time and you don't want that to be getting puffy up and down. If you naturally retain a lot of water in your face, veer away from filler. Think instead about doing the natural filler for collagen stimulation. Okay, PRF gel. Let me see what your question was. I'm trying to get there. Sorry, I'm trying to get there. What's the name of the natural filler? Oh, she was answering for us. Natural filler for under eyes. PRF EZ Gel. Yes. I have some hollowness, but only under one eye, and it makes my eyes look different. So, okay, let's talk about facial asymmetries. We all have asymmetry of the face where, one smile line is deeper, one under eye is deeper, one cheek sits higher, one sits lower. This is natural. And I don't want you to try to chase perfect symmetry. You will drive yourself crazy and probably get a really weird looking result trying to chase perfect symmetry. So don't do that. Now, what happens is if you want to minimize the appearance of these asymmetries, we can use your filler, your natural filler, your Botox to help minimize the appearance. Don't try to go for perfect symmetry. You will go crazy trying to fix that. What that means is maybe when we're doing your under eyes, if it's just one eye that's bothering you, we might just treat that eye, or it might be we do more on that side versus the other. And this is very common. Like, because people have these asymmetries of their face, the dose is different from one side to the other. But I also ask people before I just make everything look, pretty similar. I say, hey, I noticed this on your face. One eyebrow naturally when you talk goes up more. Do you like that or not? Some people are like, oh my gosh, I do not like that. Try to make them even. Other people are like, no, that's kind of cool. Like, that's my thing. I do the rock eyebrow. I always want that. So it's like, okay, that's a thing to know. And there's some asymmetries we just can't achieve. Like some people, like one side just is really down or that curls in more when they talk. And it's like, I can minimize that with some Botox, but again, trying to get perfect symmetry, I'm like, don't go crazy over that. But yeah, that's normal. And you just probably will do a different amount from one side to the other. Okay. Let me see. I'm still trying to go. Okay. I think I got those from over there. Okay. Let's see. Hi, how long do fillers last? Your filler is going to last, I tell people, between 1 to 2 years. That's when they're going to want to do their maintenance. Even when they're coming back for their maintenance, it's not like, oh my gosh, all the filler is completely gone from your face. It's not like they're back to baseline, but they have noticed it fade. So that's like a good thing to keep in mind. With the natural filler, how many times do we have to do it to notice a difference? You want to do a minimum of 2 sessions. If you are 35 years or older, or if you've had a lot of volume loss, maybe weight changes, typically we're going to be doing more sessions. We'll probably do a 3rd session. And then I say, give it some time, let it cook. No, basically let it do its thing. Let it make that collagen. It can take up to 6 months to see the full results. So I would say pause there, see the results, and then you can add more if you'd like. Okay, what do you think about masseter Botox for the snatch look? So masseter Botox we can do for TMJ symptoms, headaches, teeth clenching, jaw pain, grinding of the teeth. But masseter Botox, so this is our masseters right here. These are the jaw muscles. When they're overused, people will notice that their jaw starts to get a little bit more square and wide because these muscles are basically bulking up, always exercising. So when we Botox it, it's going to relax the muscles from being so strong. It'll help with your TMJ symptoms, teeth clenching, headaches, grinding, jaw pain. It can also slim the lower face. So when people say snatch, sometimes that's what they're meaning there, slimming the lower face. Slimming you usually will see around 2 months after that muscle has had time to relax. So it's not an instant thing. And it just depends on the face. A lot of people really like when their face looks a little bit slimmer. So I think it just really depends on you. I think TMJ Botox is just a standout, especially if you have symptoms. I'm like, if you have symptoms, definitely get that. That will change your life and protect your teeth, period. Okay. How much is EZ Gel on the smile line? So when we do EZ Gel, the 2 sessions that we do it in a 2-pack, you want to do at least 2. It's $2,550. It covers both sessions. And when we do your EZ Gel, your blood draw, we usually get about 5 syringes worth of your natural filler that we're able to use in the face. And so with those 5 syringes, depending on what we're trying to do, if you have a lot of volume loss underneath your eyes, we might be putting all 5 syringes underneath your eyes, 2.5 and 2.5, or maybe 2 and then a little bit into the cheek, and then 2 and a little bit into the cheek on the other side. If you just have like a little bit of volume loss under your eyes and it's almost more like preventative, we might be doing 1 syringe per side and then some into the smile lines. So it just depends on what's going on and like how many areas of the face we can treat with those 5 syringes. Now, I have a lot of patients that come in and they're like, I don't ever want to do filler. I want to do the natural one. I understand it's going to take time. I am okay with that. Usually, like, sometimes people in I have all ages, but usually like mid-30s to mid-40s, 50s, if they're like, yeah, I only want to do the natural one and I want to treat multiple areas, like do my face with it. And remember, when we're injecting, I'm thinking about underneath the skin, facial aging, where fat pads are separating, where they're sinking. And so that's how I inject to make it look natural. I'm thinking about what's going on underneath the skin. And I'm trying to like get ahead of that. Where we lose bone, I'm thinking about all of that. Now, when we do that, if people are like, treat my temples, my cheeks, my eyes, my smile lines, my corner of my mouth, my chin, like all the areas where I'm going to see aging, instead of drawing 2 tubes of blood like we normally do, we'll draw 4. And so when we do 4, we usually get like 10 syringes or maybe even more, just depending. And then we're able to like hit up the full face of somebody. So then I'm able to like your temples, your eyes, your smile lines, your jaw. Like we're able to just hit all the spots. And a lot of patients like that. So, and when we do double the dose, I think it's $350 extra to add on like double the tubes. Do I ever come to New York or New Jersey, Eve? Not yet, not right now, but if I do, I will let you know. How many treatments for the monthly fee? For the skin membership, it's one of those treatments. So Aerolase laser, skin pen microneedling, hydrofacial, BioRepill chemical peel. You pick one of those. If you want to stack on, so when I was saying, a lot of patients are stacking on a second or a third, it is $250 each stack on. So if they're doing the laser, the peel, the microneedling all on one day, they're going to be doing basically $399 plus $500. So it'd be $8. Is that $5, $6, $7, $8, $8.99? I went to Stanford. I can add it. $8.99 for those 3. And so that, that just depends on their goals. When we start stacking them, we're working in different layers of the skin. We're able to get the results a lot faster. A lot of patients like that. So, okay. Let me see. Can natural filler look as good as HA filler? I love both. And it depends on, I just made a video about this today when I was in the car. I made a video about this today. It depends on what you're trying to achieve. So if you're trying to get something like super snatched, super angular, like I want snatched cheeks, I want a sharp jaw, I want really defined crispy borders on my lips. I want a strong highlight down the center of my nose bridge. For those things, I think the natural filler is a little too soft. That's where we would use your filler instead. And when it comes to filler, there's different types of filler that we have, different types that we will use depending on what area of the face we're treating, depending on who I'm treating. Remember, the 97-year-old white lady is going to be different than the 25-year-old black girl. The white lady's going to have no fat in her face because she's 97, and the 25-year-old black girl is going to have a lot of fat in her face because she's young. So the product is going to vary depending on who I'm treating, the area of the face I'm treating, and what we're trying to achieve. So if they want something more structured, or if they want to see quicker results, that's when we go with filler. The natural one I love for under eyes, smile lines, like smaller, like not needing a ton of volume or like like I said, structure. Like, I don't need it so chiseled up here. That's where I'll go with natural. But I love them both. A lot of patients are getting both of them. So, okay. So let's see. So for frown lines, keep up. So to do your frown lines, to keep up like to this, like I said, a few times a year, depends on your dose. Again, I can make it just be 1 time a year if we do a really strong dose. And I have a lot of people that like that. Okay, they said I want my next one with you. I would love to see you anytime. I know your specialty is face, but what about cellulite? Do we have to do lipo? Cellulite, I don't feel like there's a lot. I don't do surgery. I'm a cosmetic nurse practitioner for the past 13 years. I don't do surgery. We have a plastic surgeon that is like our medical director, Dr. Michael Arnstein. I haven't seen really good treatments non-surgically for cellulite. I have worked with different things over the years, devices and treatments, and like, they're okay. They're okay. Like you can do maybe some collagen stimulators or Sculptra, dilute radius, but I haven't seen anything where I'm like, oh my gosh, that's perfect. And everybody's getting that for cellulite. So that's my honest thing. Skin tightening devices, guys. save your money on. Sorry, I was like, no. Okay, suggestions for alternatives to filler for volume and height in the lips. You can do the natural filler. I just don't think it's going to give you a ton of height. But the natural filler is an alternative to filler. Okay, does each section, oh, this was Stephanie. Yes. So does each section have different duration for upkeep? Yeah, okay, I think we got that one. Yes, we talked through there. Okay, now I'm going back down. Let's see the other ones if I missed anything. What do they mean the membership is something we have to pay monthly? So yes, for the skin membership, we have different things. So if you just are like, I'm only in town, like yesterday I saw a girl from New York and she's like, I'm not going to be here every month. She's like, but I'm here and I'm going to come back and do another session in 2 months. So she just bought the one-off treatment of the skin treatment. So the skin treatments on their own, if you're just like, I just want to do one laser or one pill or one whatever, I price them the same. I don't want you to pick the treatment based off of price. But if you do one of them, it is $550. If you do the package of them, we have a package of four for $2,000. So that brings them down to $500. And then if you're in the membership, you come in on a monthly basis, it's a 6-month minimum commitment. It is $399 for that month. And then you get to do one of the skin treatments. So different things depending on what your goals are. You're going to see the best results being consistent and doing this on a monthly basis. We just see so many people from out of town. I know not everybody is able to come on a monthly basis. So that is why we have those other options. If you're like, I'm only going to be here this one time, or I'm going to, buy my package and I'm going to do these 2 times. I'm going to do 2 sessions. I also try to have everything super easy with the pricing. We have all the pricing on our page, but we also will do our in-depth consult and we can give you a better price based on your concerns once we have the consults. But I give you general pricing, if you're like, hey, I want to do my cheeks or whatever, this is the price, or my lower face. In general, I'm like, okay, people are like, how much is facial balancing? I hear that all the time. So I'm like, okay, without me seeing your face and without me talking to you and knowing your goals and going through everything, I can't tell you a number. However, in general, people are going to be doing around $4,000 to $6,000 if we're treating multiple spots on their face. And we might be breaking this up into a couple sessions. We are very likely breaking this up into a couple sessions. Mostly for me, when I do it, I want to do some, let it settle, reassess. We can do more later if we want. I just don't want to overfill. The team, we don't want to overdo. We can dissolve filler, but we're not even trying to be about that life. We're not trying. We're not about that life, period. So it's easy to add. We can always add more if we want, if you desire, but wait 6 to 8 weeks. Okay, I don't even know what question was it. If I have the beginning of jowling, would masseter Botox make that worse? Teresa, possibly. So jowling, when people will notice this little fat pad. Okay, so you can kind of see these lines on me because I'm due to get some stuff in my face. So this is what is happening beneath the skin. We lose fat and these fat pads will separate. You can see these shadows on my face. I'm kind of trying to indent them more. So these fat pads separate and then they start to sink. This one keeps sinking, and it makes this jowl right here. So then people are like, oh my gosh, what is this hanging down on my jawline? What is going on there? It doesn't look straight anymore. So that's when people are referring to jowls. To camouflage jowls, we'll do filler or natural filler in front of, possibly behind the jowl. We'll do some Botox into the neck bands to camouflage it. She's asking about if you do Botox into your masseters, your jaw muscle, is it going to make the jowls appear more apparent? Because this muscle can slim out if this muscle is bulky. If this is slimmer right here, this may look more apparent. I don't think it causes jowls, but it's because this doesn't have the support in the jaw, this can look a little bit more apparent. It is pretty rare that people are seeing this, but it's something to be mindful of. If you are having TMJ symptoms, I'm like, do it. It is worth it to help support your TMJ symptoms. And then instead of just only doing the masseters, add it into, into this neck band, this platysmal band right here. So these platysmal bands in our neck coincide. This one coincides pretty close to right where that jowl is going to hit. I'm going to do some Botox when I stop breastfeeding this baby, and then I'm going to be unstoppable. Okay, I have volume loss, so that is why I was asking you if you could do both HA filler and the natural filler. Yes, a lot of our patients will do that. A lot of our patients will do both. So sometimes we're doing it in the same session, but not in the same area. It might be like they're not candidates for traditional hyaluronic acid filler underneath their eyes. So they do the natural filler there. And then we do filler in other parts of their face where they don't get puffy. So that is like where we can do it in the same instance, just not in the same spot. Other times people will tell me, hey, I want to start with the natural filler to get that collagen boost. And then if it's not lifting as much as I want, then I want to come in later and we'll do filler. And then other times people will tell me, I want to start with filler. I want to get the instant results. And then when I'm coming back for my maintenance, I'm going to do maintenance with just the natural filler for collagen stimulation. So again, no right or wrong. This is why we got to talk about your goals. I will talk to you about limitations of all the treatments of anything we talk about. I'm gonna tell you, like, here's what I can realistically achieve, here's what I can achieve, here's what I expect, all that stuff. I've been doing this so long, guys. I've seen all the things, so we just know like what to expect with the products, and I know how they work in the freaking face, period. Like, I just do it in all faces, in all. I like I said, I don't care if you're a man, I don't care if you're a girl, I don't care how old you are, I don't care what your racial ethnic background is. I do face. Like, that is what I specialize in. So yeah. Okay. I think I got these. Let me hit back down. And then, sorry, I guess I just love this too much, guys. Do you think dissolver can cause permanent underlying tissue and structural damage? I don't know. I don't know about that. But like, if you have filler that you don't like, it is worth it to dissolve it, period. Like, it's not worth it to have it there that you don't like and just looking at it for a long time. Okay, do you think soft wave helps tighten the jawline, and does RF microneedling help cellulite? My honest thing, I am not in love with skin tightening devices, non-surgical skin tightening devices. I've worked with several. I have not worked with soft wave. Even that, I don't get hyped about these things. No. Can you? Okay, so Teresa, if you want to do it, here's what I tell people. I'm like, if you want to do it, you got to find somebody that is doing it all the time and that's going to show you several before and after photos. Like, show me what it looks like 2 months out, 6 months out, a year out, so you can know what to expect. How many sessions was that? And then make sure that they're showing you people that look like you. So, if I have, again, a 30-year-old black girl in there and she's trying to talk to me about her lip filler, and if I'm only showing her a white woman that is 65 years old, the girl's gonna be like, cool, but like, that doesn't look like me. So just make sure you look at faces that look like you. If you go to my page, if you come to my office, if you see the videos that people tag of me, we see all the faces. Again, we see everybody. And it was very important to me. Like, I love treating the face, and I love treating diverse faces. I love treating all the people. It was important to me to be able to show people. I'm like, if you come to my page, I want you to see somebody that looks like you. And again, this is, thank you, God, and shout out to my patients who have like consented their photos and allow us to show their before and afters so that other people can see themselves in those results. And it means a lot for the people. I've had so many people tell me, I never saw an Indian woman getting these treatments until I saw your page. I never, one girl said to me, that's cool, show me like a big black girl. I was like, here, girl, here's what you're talking about. She's like, oh yeah, great, now that I've seen these, that looks exactly like me. I'm like, yeah, I do the faces. So yeah, make sure you see pictures that look like you. Make sure you see lots of results. Make sure they use that device all the time. I just wouldn't be rushing to get new treatments that come to the aesthetic world. Guys, I've been doing this a long time. And like, I've seen so many things come out, and the companies are very good about getting the patients excited about it, getting the providers excited about it, because they put so much like marketing dollars behind it. So they just hype it up. And so then everybody's like, oh my gosh, I got to do that. But then I have seen things get taken off the market because they didn't live up to the hype. Not just live up to the hype. They actually caused more harm than good. And so I'm like, don't rush to get these new treatments. Soft wave, I mean, whatever, it's probably fine. It's just newer-ish to the aesthetic market. I don't think it's gonna like harm you, but is it really gonna do what you're trying to achieve? I don't think so with non-surgical tightening devices. I've just worked with too many in the past, and the patients were like, I don't see any change, or I think I see something maybe. It was just too mixed. If I do something, I need the people to be like, I see it and I like it, period. And I need to stand behind it. I can't be on here talking to you guys about these treatments and like, that's my word. I can't be like lying to you guys about this stuff. So, okay. Let me see. How do you know if you're a good candidate? Deja vu. I don't know which one you're talking to me about. So if you want to know if you're a good candidate for any of these treatments, that's why we do a consult. So that is where we will go through everything and I will tell you yay or nay. I don't think this is going to serve you. We talk it all through. And my patients know I don't want to say I'm quick to say no. It's not my way or the highway, but I'm going to be real with you. Guys, like if I say it and if I believe in it, if I take this on to do, I'm like, I need to get the result. So I don't want to be like, yeah, I can do this. I can get this. I can lift you up and I can give you these brows like this. I don't, because then if I don't achieve it, you're gonna be like, girl, what do you mean? You didn't do the thing. So I will tell you realistically, if like, hey, this is what you're gonna be able to get, this is what you're gonna be able to see, this is what I expect, this is what I don't expect you're gonna see. And if you're trying to describe something that I can't get, I'm like, nope, it's not gonna do it. And if we're not on the same page, I'm like, let's pause this today. It's not my way or the highway, and it's not that we may never do this, but like let's both pause and think about it and then like come back to this and regroup. I just want us to both be aligned when we're doing stuff. Yeah, and our patients are so wonderful. Like, I love our patients. We have the best patients. I'm so grateful for them. Layla said, I don't have any questions. I'm just here to say I'm excited for my appointment. I cannot wait to see you on Friday. Yay, I can't wait to see you. I'm so excited. Okay, did I get all the other ones? I hope I got them. Thank you for the honest and informative responses. Yeah, it's important. I just say this, guys. I don't know. I've heard from so many providers in this. Fortunately, I've worked in nice places in my career, so it's all been good. But like when I'm talking to nurses from these other spots and they're just like, dude, these things are so driven by sales. So you want to be careful. Like, I don't even want to get on this. I don't want to get on this. So much stuff is driven by sales. So much stuff is they're just trying to get the freaking next buck. They're just trying to get the highest profit. Like, no. It's your face. Don't be rushed with any of this. Understand who you are seeing. Like, make sure you know who you're seeing. Make sure you research them. Make sure they are freaking licensed. I'm sorry, I'm like getting mad. That's the worst bad words I say is freaking. But make sure they're dang licensed to perform these treatments. That they are equipped if there is an emergency to handle what is going on. They inform you on what to look for. You need to be making informed decisions, not rush decisions. I say this a lot. Don't rush it. Don't go somewhere because you see it for $50 off. I'm telling you, how many times I've had people come to me to fix something and they're like, oh, I couldn't get in with you, so I just went there, or this place was cheaper. I have seen it so many times. I'm like, dude, to fix this, it is costing you way more than if you just did it right the first time. Don't rush it. Do not rush. Do your research, okay? Like, yeah. Yeah. Sorry, I'm not going to be yelling. I'm not ever mad at y'all. I'm just get mad at like, dang, people mess up their faces. And then I definitely get mad at people that are just straight up trifling and doing the wrong thing to people for a quick dollar. I don't know how they live with themselves. But anyway, Sylvia, can you get Botox on your nose? I feel like it's droopy at the tip and makes me so insecure. So you can do Botox at the base of the nose. It helps to like prevent the nose from like drooping if you talk or smile. If at rest, your nose is naturally angled downward or it looks like it's drooped, it's not going to like, oh my gosh, make it lifted and twist it up like that. That's where we're going to do filler or surgery. And so if you go on the top of my page, there's a nose filler like tab or whatever, a series that you can click through like before and afters of nose filler. If you're like, oh, my nose looks curved down and I want it straight and you're not smiling, then that's going to be a filler thing. If you're just like, oh, only when I talk, my nose kind of like droops down, or when I smile, it droops down, you can try Botox and see if that does what you're trying to do. Okay. I think I got all of them. If you, in your opinion, what's the quickest solution for hollow under eyes? Quickest solution is your filler, but you got to be a candidate. Can't cry a lot, can't have bad allergies, can't wake up puffy, can't retain a lot of water around your eyes. If you have any of those, don't do filler. You're going to mess your face up. So we don't always want quick, guys. We want to have the right result. We want to have a safe and really nice looking result. I say that if you are going to see somebody that does under eyes, they better do this under eyes all the time. You better be looking at their before and afters. You better be seeing people that look like you. So, okay. So that's what I only say, my patients know, they're like, I know it's not quick. You're going to see the result and we're going to get you the dang result. But like, I don't want you to just rush things. People, when they get impatient, I just went to this spot. It was $50. I'm like, what? So anyway, Sylvia said, I might have missed you answer my question. Sylvia, tell me your question. Let me see. Oh yeah, the nose. I just talked about that one. So if if it's that your nose twitches when you smile or talk, then you can do Botox. If your nose is naturally angled down, then you can do filler. If it's like not just when you are talking. And I said you can go on my page and look under the nose filler tab, and you can see a bunch of patient before and afters and me explaining like nose filler versus Botox. Okay. Let me see. Okay, we talked about that one. Botox, Dysport, etc. don't work anymore. Now what? Dang, that sucks. And I'm so sorry, Elle. So there are some people where they get like immune to Botox. And when I was earlier in my days, I would only see it in patients that had been doing it for like 10 plus years, that they would tell me, oh, my Botox doesn't work anymore. And then we'd switch them to Dysport and they'd be fine. After 2020, things were a little different. I felt like after the people were getting the jabs, I don't know if we just have different immune responses, but I saw some people getting like they don't respond to Botox. It was happening more of like 2020, 2021. I haven't really heard of it too much in these recent like 25, 26, 24. Haven't really been hearing that chatter as much. However, even one of my medical assistants has been with me for like almost 4 years. She is immune to Botox. Like I did her, she'd been somewhere else before and had it probably done 3 times and it worked. I did her probably 3 times, it worked great. And then like one time it didn't work. I was like, oh, that's weird. And we retreated her and it still didn't work. And I was like, what's going on? And then we treated her again with like all the different ones and it still doesn't work. And it's probably been 2 or more years that like nothing, she doesn't respond to anything. There's been some research. I haven't seen a lot on this, so you can try some of the other brands. Lady Bobo is a new one that they say may help. Oh, there's another one I forget. MyoBlock is the other brand that may help because it's a different strain of Botox, of the like Botox molecule that you can try. And then I was seeing somebody doing some studies with mixing it with hyaluronidase. So that's like the Hylenex, and they were saying that was helping, but talk to your provider. I don't know. I'm sorry, and I know that sucks. There's a couple people I know that have like got immune to it in my practice. Just a couple where it's like it used to work and then it just doesn't. And all the different brands we've tried. So only a couple, but here and there it can. Okay. Okay. Oh, sorry. I'm trying to see if I can see these other ones. Best thing to do with smile lines. And here you can soften them, not try to get them all the way gone. Soften them with filler or natural filler or dilute radius or Sculptra. The collagen stimulators are the natural filler, dilute radius, Sculptra. So those will get better over time. The regular old filler is going to give you your instant result. When we're doing smile lines, we got to consider what is causing these lines to get deeper. Usually it is from volume loss through the mid face and maybe even the upper face. So those fat pads separating, sinking, and pushing down. So sometimes it's not just that smile line retreating, but it also might be some filler into the mid face, into the temples, so things look natural. We don't want to treat in isolation. If you're only spot treating, that's when things look weird. You guys have all seen people who have spot treated because they just have their lips done. Big lips, short, recessed chin, saggy corners of their mouth. They're spot treating. You don't want to spot treat because it looks telling. It's like you got one part of your face that looks fresh. All of a sudden you don't have smile lines and this is still pushed down. It's going to look off. So this is why we got to consider your full face from all the angles, how you're moving in motion. All of that plays a role when we're doing your treatments. Okay. Let me see. MyoBlock. Oh, she said, should I wait a year or something? Yeah, I would wait a year because you don't want to keep like building up that response. Or if you try it again, when you try it again, do like one area, a small bit, maybe do like one, whatever you notice it, like one eye maybe, and see. Like do a dose, like do I see it? But no, I wouldn't go like your full regular dose, 60 units, 100 units. I wouldn't do all that because like you don't want to keep building up that immune response to that Botox. Hi, Milton. I hope you're doing good. Okay. Best filler for lips depends on your goals, depends on your baseline. I like a lot of Restylane Contour, but depends on the lip and what's going on. Okay, I think I got the questions. And I think, okay. I think I got them. I think I got them. If I missed them, I'm never trying to like skip any questions. Sometimes I've already seen things on here like, oh, we've blocked some of the community comments. So sometimes I don't see them all. Oh, I have not done glutathione. No, I know one of our doctors I used to work with, he used to do IVs of it. He liked it. I've heard good things from patients about it. But I'm not trying to miss any questions. If I miss questions, you can throw them in the chat before I jump off. Also, we can set up our time to consult. So you can do that at the top of my page. We'll have time to go through your questions, goals, tips on what to expect, how to prep for treatments. The consults virtually are $150. That goes towards your treatment if you do treatment within 3 months. But it's just time for us to like start building out your treatment plan, give you all the prep to do beforehand so that you can heal easier. We go through making sure the timeline is right for you, planning for your events. I don't want you doing this too close. If you're like, it's my wedding, it's my whatever, I need to have time. Right now, everybody is getting ready for, I heard a lot of Jazz Fest today on my consults from patients. I've been hearing a lot of, it's like all the music festivals right now. Coachella, everybody's been getting ready for that. So all of that I've been hearing. People are getting ready like spring and summertime. One lady said, I need to be summertime fine. I was like, I like that. So everybody's getting ready. Like, you want to be thinking months in advance when you're doing these treatments. Do not come in and be like, I need to be ready by next month. I'm like, no, it's not going to work like that. So we just want to have time for things to settle. There's a lot of considerations. As you guys see, it takes me forever to like explain all the stuff, but build out your treatment plan. We send you pricing info. We send you financing if you want to do that. We send you the stuff. We send you videos pertinent to what we talked about. We see all the things. So everything we can talk through at any point. If you have any others, questions, like I said, set up the consult time, call or text the number at the top of my page. I will come on live again. I've been trying to make more videos. But yeah, and also come see the team. We're in Los Angeles. We're in Las Vegas. I appreciate you guys so much for coming on. I hope you guys have a wonderful night. I'll try to come on tomorrow. We're going to Monster Truck Show for my 3 boys. All right, I'll talk to you guys soon. God bless you.